Hello, I'm Dr. Sharol Fernandes, consultant psychiatrist, and today I'll be talking about anxiety disorders. So, as we all know, anxiety is a very normal emotion, and most of us experience it at some point of time or the other. So, usually it's experienced when we are in some sort of a stressful situation or having a new experience, like maybe meeting some people for the first time, being in a new place, having to face an interview or an exam, or having a performance to do, etc. So usually it's quite normal when it's transient and it's passing. It does not stay for long. It's normal and it's okay to feel anxious. However, in certain situations it can become a disorder. When is this? So when the anxiety levels are so high that it sort of interferes or makes it difficult to go about the day-to-day functioning, it is labeled as an anxiety disorder. And to be very honest, anxiety disorders are one of the most common psychiatric disorders, and individuals with this condition are what psychiatrists see very frequently on a day-to-day basis. Now, when you come to anxiety disorders per se, there are various kinds of anxiety disorders as a classification, which is usually based on the specific situation or the object of the anxiety. So, the first type would be the generalized anxiety disorder, where an individual feels anxious in all situations throughout the day. So be it meeting people, going out of the house, going about the daily activities, they kind of feel anxious in every possible situation, which makes it difficult for them to function. The second type is something called a social anxiety disorder or social phobia. Here the individual feels anxious in social situations only. So they are able to do the other activities, but when it comes to meeting people, having to give interviews, having to give a performance, that is when they feel really anxious and are not able to do the task at hand. The third type would be something called a specific phobia, where the individual has a fear, anxiety, or phobia related to a specific situation or a specific object. For example, fear of heights or fear of lightning, thunder, animals, etc. The fourth type would be agoraphobia. Here the individual has a specific anxiety or phobia related to being in places from where easy escape is not possible. So these people, they are very scared to be in places like the market or the bus or the train, etc., from where if something happens they won't be able to get out of it very easily. So it's called as agoraphobia. And then you have something called as anxiety disorder unspecified, where the individual has symptoms of anxiety, but it could be not limited to any of the above mentioned disorders. And the last one is the panic disorder. So panic disorder is the specific anxiety disorder where the individual has panic attacks. So these are the various kinds of anxiety disorders, and this is in brief about anxiety disorders.